Thank you for joining us at CHCI's 2021 Spring Policy Summit. My name is Ron Estrada. I'm the Senior Vice President, Head of Government Relations and Corporate Social Responsibility for Univision Communications and CHCI Vice Chair. On behalf of CHCI, I would like to thank Dara Fresenius Medical Care North America, and Pfizer for their generous support of this session. This panel discussion will address an issue that has been front and center in all our lives over the past year: the impact of COVID-19 on the Latino community and access to vaccines. Today, you will hear from local and national leaders as they discuss new developments around the COVID-19 vaccine and how health experts, policymakers, and Latino leaders can build stronger relationships between the health sector and Latino communities. As your MC this afternoon, I'll have the distinct privilege of introducing our panel host, Congressman Raul Ruiz, and our moderator and my colleague, Yarel Ramos. Our panel host, Congressman Ruiz, is also Dr. Ruiz. He graduated from Harvard University, where he earned his medical degree as well as a Master's of Public Policy from the Kennedy School of Government and a Master's of Public Health from the School of Public Health, becoming the first Latino to earn 3 graduate degrees from Harvard University. Dr. Ruiz worked as an emergency room doctor until he was elected to the U.S. House of Representatives in 2012. He represents California's 36th district, which includes the entire Coachella Valley, as well as cities of Banning, Beaumont, Blythe, Hemet, and San Jacinto. Congressman Ruiz is the current chair of the Congressional Hispanic Caucus and also a member of the Congressional Hispanic Caucus Institute Advisory Council. I'm delighted to introduce our moderator, Yarel Ramos. Yarel defines herself as the quintessential first-generation Latina millennial. She graduated from the University of Miami and is now pursuing her master's degree at USC's Annenberg School of Communication. Since 2017, she's anchored Univision's new midday show Edición Digital California and has done a fabulous job. I encourage you all to stay engaged in this discussion on social media using the hashtag CHCI Summit. Now, without further ado, please welcome Congressman Raul Ruiz.
Good afternoon. Thank you for having me today. My name is Congressman Dr. Raul Ruiz, and I represent California's 36th Congressional District in Southern California. I'm an emergency medicine physician and a public health expert with training in humanitarian and disaster aid. I'm also chair of the Congressional Hispanic Caucus. It is a pleasure to be with you at the Congressional Hispanic Caucus Institute's 2021 Spring Policy Summit as we look to discuss Latinos and COVID-19, the vaccine phase. Thank you to CHCI for developing the next generation of Latina and Latino leaders by providing leadership, public service, and policy experiences to outstanding students and young professionals, and for convening elected officials, advocates, and leaders to discuss issues facing Hispanic communities. As the son of farm workers who grew up in an immigrant community and the first generation in my family to graduate high school, I understand firsthand the values of creating support and opportunities for a brighter future. This past year, we have seen Hispanic families carry the brunt of the COVID-19 pandemic while courageously stepping up and risking their lives as essential workers on the front lines as farm workers, meat packers, caregivers, doctors, nurses, and much more to keep us safe, healthy, and fed. They've stepped up for us. We must step up for them. There are unique barriers that Hispanic communities face regarding access to COVID-19 vaccines, including a lack of reliable information in their languages, misinformation, exclusion from our healthcare systems, and fear of deportation. We must use equity in the design and implementation of public health outreach and education. We can do so by shifting our vaccination efforts from a first-come, first-served basis to one that centers on equity. We must use community health methods to proactively allocate vaccines while working with trusted community partners, local community members, and organizations who know the community and can take the vaccines to the people using a culturally and linguistically sensitive approach. It works, but we need the know-how, the motivation, and the proactive efforts to ensure it gets done the right way in our communities. We also have a duty to counter vaccine misinformation and remind our community with targeted messaging of the importance of getting vaccinated and protecting themselves, their families, and their communities. The CHC is committed to eliminating the barriers and systemic inequalities Hispanic families face and deliver progress for our communities. So thank you for having me today, and thank you to CHCI for strengthening and empowering Hispanic communities. Together, we can create lasting change to ensure the promise of America is accessible to the 60 million Hispanics living across our great nation. Thank you.
Good afternoon and welcome. My name is Yarel Ramos and I am the anchor of Edición Digital California at Univision in Los Angeles. I'm pleased to be here today to lead a very timely discussion on Latinos and COVID-19, the vaccine phase. I would like to thank Congressman Raul Ruiz for setting the tone about the importance of the COVID-19 vaccine in our communities. And thank you to CHCI for providing the Latino community an opportunity to engage in this discussion. As Americans look with hope towards the future, towards the end of the COVID-19 pandemic, Latino leaders have worked tirelessly to ensure that our communities are adequately informed about the COVID-19 vaccine and that our families have equitable access to these life-saving treatments. This week, we had news from the CDC, an update that fully vaccinated people no longer need to wear a mask or physically distant in any setting except where required by federal, state, local, tribal, or territorial laws, rules and regulations, including local businesses and workplace guidance. We're going to be digging into that later in our discussion, but we'd like to also hear from you, our audience. So please continue the conversation on social media using the hashtag CHCI Summit. Today's program will include an exciting group of leaders discussing Latinos and COVID-19, the vaccine phase, and a discussion will be followed by a special guest, a speaker from the COVID-19 Health Equity Task Force. So without further ado, I would love to welcome our panelists today. Let me introduce to you our first panelist, Dr. Rob Cosman. He's the Chief Medical Officer at Fresenius Medical Care North America. Dr. Cosman, thank you for being with us today. How are you?
I'm well. Thank you for having me. I'm really pleased to be here. For the audience, I'm a nephrologist, a kidney specialist in Santa Fe, New Mexico. I've lived here for 27 years and for 20 years was a doctor in clinical practice here. And more recently, I'm the North American Chief Medical Officer for Fresenius Medical Care, a global company whose focus is in complex patients with individuals with complex medical needs, especially those needing with kidney failure, needing kidney dialysis treatments or critical care. We're not a household name, but we are a big company with a big heart focused on people. So very pleased to be here today.
Thank you so much, Dr. Cosman. Next, let's welcome Dr. Dara Richardson Herron. She is the Chief Patient Officer at Pfizer. Dr. Dara, so great to talk to you. How are you doing?
I am doing terrific. Thank you so much, Ms. Ramos. And let me also say a huge thank you to the Congressional Hispanic Caucus Institute for inviting me to join today's policy summit. It's really great to be here. You know, I describe myself as a physician by trade and an advocate by choice. And I have had a 25 plus year career focusing on finding ways to decrease the burden of disease and most importantly, to connect with and be an advocate with and for patients, particularly those who have been underserved by our nation's healthcare system. And in my role as Pfizer's Chief Patient Officer, I have the opportunity and might I add, immense responsibility of making patients our North Star, our partners, and our focus in everything we do. We're committed to advancing breakthroughs that change patients' lives, and we're keenly aware of the responsibility that rests on our shoulders, and we're so very proud of our efforts to develop a COVID-19 vaccine with our partner BioNTech. And I have to say that the Pfizer BioNTech COVID-19 vaccine has not been approved or licensed by the FDA, but it has been authorized by the FDA under what we call an emergency use authorization to prevent COVID-19 COVID-19 in individuals now 12 years of age and older. And so I'm really proud that Pfizer is committed to helping improve health for patients all around the world. And I'm just excited to be here today to have this conversation with each of you.
Great. We're really excited as well to have you. And finally, we're pleased to have Sally Embry. She is the Vice President of Public Health and Medical Technologies at DataRobot. Sally, thank you for joining us.
Hi, thank you so much for having me today. Really, really appreciate it. Yeah, just to introduce myself briefly, I am an epidemiologist and an engineer by background. I have been deeply embedded on numerous COVID-19 initiatives at the federal level through my company, DataRobot. DataRobot is traditionally an enterprise AI organization, but when the pandemic began, we started to reallocate 50% of our R&D resources to fighting COVID-19 as a data science problem. And this has led us to be deeply embedded with federal partners at HHS, CDC, NIH, FDA, and we are really excited about our ability to predict the spread of COVID-19 and help identify where cases are surging and how we can move resources into areas that are in critical need. And also think about future pandemic preparedness too, as we kind of hope for that bright new day that you mentioned in the introduction.
Great. Well, thank you so much for being with us again, and welcome to all of you joining us online. We're going to jump right in to our first question. Dr. Dara, this one's for you. We know that COVID-19 has had a disproportionate impact on communities of color, minority populations across the U.S. Can you talk about the impact of this pandemic on communities of color in general and on the Latino community specifically?
Yes, absolutely. You know, this devastating pandemic has had an incredibly disproportionate impact on racial and ethnic populations across the U.S. And we unfortunately learned early on that the virus is not impacting all people equally. We know that older Americans, along with vulnerable, underserved communities, including racial and ethnic minorities, are facing really increased risks of both contracting and suffering serious consequences as a result of COVID-19. You know, it's just one example. The CDC has released data showing that after adjusting for age, Hispanic Americans are shown to die at a rate of nearly 2.3 times that of white Americans, and approximately 3 times more likely than white Americans to require hospitalization. And you know, as additional data, as of May 13th, Latinos currently comprise about 29% of COVID-19 cases in the United States, despite making up only approximately 19% of the U.S. population. And these same disparities exist at the state level. You know, and as it relates to vaccination rates, as of the 13th of May, over 118,000 people in the United States have been fully vaccinated. And although racial and ethnic data is only available for about 59% of those people, we know that only 11% of that population are Hispanic, 8.5% are Black, 1% are American Indian Alaskan Native, and 5% are Asian, and a full 65% are white. And, you know, the reasons for this vaccine disparity that we're seeing are many. There was also data from the Kaiser Family Foundation Vaccine Monitor this month that showed that there's a lack of information, there's a lack of access that continue to be barriers. And Black and Hispanic adults are much more likely than white adults to be concerned about having to miss work due to side effects or having to pay out of pocket for the COVID vaccine, even though it's free, or not being able to get the vaccine from a place they trust. And a full 45% of Hispanic adults in the survey said that they don't have enough information about when they can get vaccinated. And a similar amount share that they're not sure whether they're currently even eligible. So there's some real opportunities there. And then the last category that I want to talk about is, you know, Hispanic adults and Black adults. Are somewhat more likely than white adults to say that they want to wait and see before getting vaccinated. And, you know, as a physician, this is very troubling for me for many reasons. And it's most importantly, it's troubling for me because those who are at perhaps the greatest risk of COVID-19 are among the least likely to get vaccinated. And and thus may suffer serious consequences and even unnecessary deaths.
All right. Yeah, I mean, just, you mentioned that the study from the Kaiser Foundation, and it was one of our news stories this week. And, in that conversation, it was also the problem with equity, the problem with immigration status, with with being scared for taking time off from work, which is something very real for our communities.
Or even,
Right, which is something too that we've seen has been disproportionately affecting communities of color. Ms. Embry, what data underlines how that Latinx community is negatively impacted by COVID-19 compared to other groups? Sorry, with the work that you do.
Yeah, so thinking back actually to the summer of 2020, that second wave, Data Robot was actually helping the federal government make sense of the data that was coming in, and just from all over the country. And if you weren't embedded in the information at that time, maybe you don't really remember, the data was very inconsistent at best. Data was coming in from every state, community, county, and it was all being reported very inconsistently, which made it very difficult to understand what was accurate, what trends were emerging. So Data Robot worked really hard to clean up that data, ensure its accuracy, and then used AI-driven models to basically pull out the trends that we were seeing and make sense of that data in of itself. And one of the clearest trends that was emerging was that the Latinx community was actually being not tested near enough in comparison to its population and in relationship to number of cases of COVID-19 that were emerging in those communities. And just to kind of further break that out, white populations were being dramatically over-tested. African-American populations were being tested approximately in line with the overall population. And it was really the Latinx community that was being very, very underserved. So generally, scientists believe that access to frequent antigen testing or frequent testing as a whole, accurate testing as a whole, is one of the clearest ways to break the chain and break the transmission of COVID-19. So having a disproportionate underserved testing in an area that's also facing a high degree of cases really amounts to that community being set up to not being able to accurately prepare for outbreaks to occur or surges to occur. So it really set the Latinx community up for not being able to respond effectively. However, it's obviously not the community's fault. As Dr. Dara mentioned, there were many cases of inequity and social determinants of health that impacted the community's ability to access testing. And we're now seeing that reflected within the vaccines as well. And that's very worrisome. We need to make sure that everyone has equitable access to the vaccine because that's really the key to stopping the pandemic in its tracks.
Right. I mean, everything you mentioned and Dr. Dara mentioned, I feel resonates so much because as a newscaster, as a journalist, it feels like we knew this from the beginning, right? With just informing and trying to empower communities of color. We've known this, and it's something that was very scary and very real for a lot of us. Dr. Congressman, what are some things you have done to address vaccine hesitancy? Because I feel like that's also something that is very tied with minorities of color. What has worked in your research, in your work?
Yeah, so a couple of things here. One of the things, starting with some of the comments that have just been made by both the other panelists, is with respect to kidney diseases, which is where a large part of our focus, or principal focus of our company is, particularly in our dialysis units. Communities of color are at increased risk for kidney disease and actually overrepresented in the dialysis population because of the predilection to things like high blood pressure, diabetes, and other things that set individuals up to be at risk for kidney disease. These, by the way, are also risk factors for acquiring COVID-19. And then you marry that to the fact that the dialysis patient population actually is at the highest risk for complications, including hospitalization and mortality, on par with any other of the highest risk populations like nursing home patients. This is a big issue for us. And so as a company, we did a few things. Early on, we provided masks and universal masking for our patients and staff. As the vaccine became available, we recognized early by following some of the surveys, including the Kaiser Family Foundation and others, that suggested that there were concerns in the general public and in communities of color in particular. So we put together a task force, and we've actually started by asking and listening what concerns are. We wanted to hear from our patients, hear from our staff. Our staff is also very heavily represented and reflects the community that we serve. And so in hearing that, we understood more where their concerns were and what those educational deficits were. So we've provided a series of town halls, including a patient town hall, with ability to re-listen to those or rebroadcast, as well as provided written material. And again, then circled back and listened again, asked again, how are we doing? Are we able to help you with this? And then finally, I think we'll touch on this subsequently, but we reached out directly to the federal government saying dialysis units in the United States disproportionately have representation of communities of color. We would like to become the access point for them to receive this vaccine, the COVID-19 vaccine, since we provide the other vaccines and have a very well-established mechanism, and we're a trusted place that people can come to.
Right. Oh my God, so much to take in, Dr. Cosman. Rob, thank you for that. Dr. Dara, something I think that a lot of us have questions about when it comes to the vaccines are the trials. Did you include Latinx patients and other people with diverse backgrounds and experiences in the COVID-19 vaccine clinical trial? And if so, why is this important?
Well, first of all, absolutely we did. It is so very important. I always say, if you're not part of the research, you may not be part of the cures. And so clinical trial diversity was a huge priority for us. If you're not represented and underrepresented, it makes it much more difficult for researchers, regulatory agencies, and physicians to understand the extent to which a medicine or a vaccine can help certain subsets of the population. That's why we were very intentional about including diverse communities and people with different racial and ethnic backgrounds in our study. Our study team selected trial sites in diverse communities and worked with those sites on a one-on-one basis to better understand their needs and also make sure they understood our commitment to diversity. And we also encouraged them to work in close partnership with community partners. I love what Dr. Cosman said. You work with the community. That is what you need to do. We've all heard the phrase, nothing about us without us. It's so important to work with the community and listen to them and understand what they need. And we knew that we could not achieve the diversity alone. That's why we partnered with a range of grassroots multicultural organizations to raise awareness and understanding about the need for and the value of participating in clinical research. We worked with groups like Dia de la Mujer Latina, the Hispanic Federation, the National Hispanic Nurses Association, the National Hispanic Medical Association. And, our efforts led to some virtual events and co-creation, partnership in the development of culturally sensitive and relevant campaigns, collateral, public service announcements, and more. And you might say, well, what was the outcome? Well, I'm glad you asked, because the great news is that approximately 42% of our global trial participants came from diverse backgrounds, and that included 23% Hispanic participants, 10% Black participants. And I have to flag that these enrollment numbers in clinical trials are significantly higher than the average minority participation rates in other clinical studies in the United States. But it works so well because now we have a vaccine and we know that it's been tested in many of the communities. And so it's really a great thing. And it just shows the beauty of working with community partners and also talking directly to people and understanding their needs and partnering together.
Right. That is amazing. That is so important. Thank you, Dr. Dara. Ms. Embry, how have vaccine clinical trials and medical research contributed positively towards the COVID-19 just federal response in general?
Yeah, so I'm probably asking people to dredge up a bunch of suppressed memories here. But thinking back to the summer of 2020, at one point the FDA actually hinted that they were going to have to slow down some of the vaccine trials. And if you don't remember that moment, you're probably like, why in the world would they do that? Considering, over the past couple months, we've gotten to see how beneficial the vaccine rollout has been. But at the time, the trials weren't very diverse. Certain trials weren't very diverse. In fact, they were largely recruiting based off voluntary interest, and it was largely recruiting white healthcare workers. And that's kind of representative of those clinical trials that Dr. Dara spoke about in the past. They're typically 80 to 90% white. And we knew that was going to be unacceptable when it came to COVID-19, especially seeing that communities of color were the ones that were most often impacted by COVID-19 as well. And it's also that diversity is so important for understanding true efficacy and safety concerns of the vaccine in of itself. So there was this concern at the moment that maybe the FDA was going to slow down or even pause the clinical trials. And one of the things that we were really dedicated to at DataRobot was making sure that didn't happen, that we could increase the diversity of the trials while also maintaining the speed that was necessary to get those vaccines approved. So we worked with several of the vaccine candidates in order to understand where cases were going to emerge 8 to 12 weeks in advance of those cases actually emerging. So we had better forecasting models into the future of where those cases were going to emerge. And why that was so important was because a lot of the vaccine trial manufacturers were basically building enrollment sites where surges were currently occurring. And when that happened, by the time those sites actually opened their doors, the surge had passed and then recruitment became very difficult. So by using forecasting models that looked into the future about where those cases were going to emerge, you could be more responsive and open your doors for enrollment in advances of those surges happening. And so that was very, very important for basically speeding up the enrollment period and also ensuring that the vaccines were approved on the timeline, a rapid timeline, as we all know. November of 2020. I think a lot of people guessed that was not going to be possible, and we ended up being able to succeed at that. And then when it comes to the wider medical research community, it's a really, really exciting time. More research has been published on COVID-19 than Ebola, than even malaria, and it's effectively a disease that's only been around for 18 months. So, there's a lot of opportunity in terms of medical research that we're going to be able to basically mine from and learn more from. But a thread that has really emerged in that medical research community and kind of throughout the COVID-19 response is that diversity is going to be essential. Understanding bias, reducing that bias, increasing diversity is going to be essential. And I'm really excited that we're going to be kind of moving forward with eyes wide open, more so than we have in the past.
Great. Dr. Cosman, Rob, what are you doing to expand access to vaccines amongst your patient population? And what are the obstacles that are preventing Latino communities from even accessing these vaccines?
Yeah, so within our populations, I would say we're quite fortunate with where we are today. And so what I would start by saying is that when vaccine first started becoming available in December of 2020, we as a company recognized, and the medical office in the company together with our business partners immediately began to have conversations with public health officials at the CDC and at the federal government level, pointing out that one of the most vulnerable constituencies in the United States are patients with kidney failure and end-stage kidney disease. This includes kidney transplant patients, patients on dialysis, and this is a group of about 750,000 patients in total in the United States, of whom a significant portion, about 500,000 people, rely on dialysis. Early on, we wound up with some very good state partnerships that allowed us to begin to get access to vaccine so that we could bring it to the dialysis clinic and bring the vaccine to the patients. And as I said a few minutes ago, we have a very large proportion of our patients are Latino patients and African-American patients. And so we represent a very good way for those communities to get access to the vaccine. In late March, we entered into an agreement with the CDC and the federal government to be able to be a distribution site for dialysis units. Fresenius is one of a couple of companies, two companies, that then makes the vaccine available to all dialysis clinics, sort of in a hub and spoke approach. We had the infrastructure to maintain the cold chain required for the Pfizer vaccine. We're exceedingly grateful to have that. And today we're sitting in a very good position with respect to having disseminated vaccine to a high proportion of our patients, and in particular, our patients in communities of color. But this activity is very much making the vaccine available. It's key to continue to address those hesitancies. And again, that listening and that asking that I was talking about earlier, because our goal is to try to get to 100% on vaccination. We're not at our goal yet, but we are very proud about the strides that we've made, both with patients and staff.
That's incredible. Thank you, Rob. Dr. Dara, this is something I think that we've been talking about for the last few months, especially again in communities of color. Why do you think some communities, in particular communities of color, have higher rates of vaccine and in medical mistrust in general?
Well, if we're honest with ourselves, we have to be clear that communities of color are not always treated with the dignity, the concern, the respect that they deserve by the medical establishment or by others. We can talk about historic transgressions where people of color were treated inhumanely, and in some cases were even harmed, like the Tuskegee Syphilis United Services Preventive Task Force study. We can talk about the unauthorized use of Henrietta Lacks cancer cells. We can talk about the Guatemala syphilis experience, the Havasupai tribe experience. Sadly, the list goes on and on. And unfortunately, these things have led to mistrust and a lack of real confidence that healthcare providers and systems have our best interests at heart. And we don't even have to just think about historical terms. I mean, many communities of color continue to face barriers to accessing health services still today, irrespective of socioeconomic status. There's institutional and systemic racism, implicit bias, and microaggressions. And for the life of me, I don't know why we call them microaggressions, because many of them actually are macroaggressions. But when you think about all of these things together, these egregious acts can leave a long-lasting legacy of mistrust in our nation's healthcare system. And that affects the willingness of some people of color to participate in potentially life-saving research, to take life-saving medicines, or even to receive vaccinations. And, I have to say this, vaccine hesitancy didn't just start with the COVID-19 vaccines, right? Remember, only an estimated 45% of American adults received the flu shot in the 2018-2019 flu season. And that number was even smaller when you look at community and adults of color, where just an estimated 37% of Hispanic Americans and 39% of Black Americans received the flu shot. But I agree with the comment that was made before. I don't think vaccine hesitancy is the entire story here. I think there is still some hesitancy, but I just don't want us to internalize this hesitancy narrative to the point that it ignores the realities we are facing as it relates to the distribution of the vaccine and access. As I mentioned before, the fact is many Black and brown and older communities are moving from hesitancy to acceptance. But we're unfortunately hearing and seeing that many people of color are getting frustrated given the real and perceived disparities and inequity in being able to access the vaccine, whether it's challenges with the online enrollment sites. I know things are getting better, but long lines, closest site being miles away, limited access, and as we talked about before, not even having childcare or don't have paid sick leave or can't take the time off. So these barriers must be addressed in our efforts to rebuild trust. We have to increase vaccine uptake, and most importantly, we have to make it clear that vaccines save lives, because according to the CDC, just as of the 13th of May, the Latinx community has lost more than 71,000 lives far too soon. And that's in the US alone from COVID. I find that to be totally acceptable. We have to change that.
Right. So just gives me the chills just hearing those numbers and the realities that you're talking about when we're faced with all of these barriers and that we see them in our communities. Thank you, Dr. Dara. Dr. Cosman, this week, just news from the CDC, new guidelines on mask wearing. And you know, still Latinos are reluctant to get the vaccine. How can we leverage this to encourage more in these communities to actually get the vaccine?
Yeah, I mean, I think that, and Dr. Dara mentioned this. I think that there is movement in communities of colors and the Latino community as well. I think we're seeing it as well towards a gradually increasing receptiveness. You know, I think human psychology is such that if the way we're trying to persuade people is with, if you'll pardon the term, threats, right? We're saying, do this or something bad will happen to you. You know, people do act out of self-interest, but most of us respond to positive things too. And there is a positive message here, and that's part of what came out from the CDC. You know, our hopes for an early-ish or early as possible end of this pandemic comes through medicine and science and the promise of vaccine, that it will give us protection so that we will not become infected, our families will not become infected, that we'll be there for our loved ones and they for us. But we'd also like to return to some sense of normalcy. We'd like to get together with our friends. You know, I'd like to see my adult daughters again and have them not worry about things. And be able to get together without masks. And what we hear now is a positive message, right? That we are reaching a point that fully vaccinated individuals we see with Moderna and the Pfizer vaccine, and also with the return now of the J&J vaccine, high enough levels, very efficacious levels, particularly with these mRNA vaccines, such that we can tell people they can get together if they're fully vaccinating, meaning 2 weeks after their last dose of the vaccine, in limited circumstances. So it's very, very welcome, very positive news.
Right. We're closing. We're getting close to our time here, but I would love to hear also from Dr. Dara. Can you tell us about the FDA's recent authorization for vaccine use in adolescents 12 to 15? And this is actually one of our audience questions.
Absolutely. We are so excited that earlier on Monday, May 10th, Pfizer and BioNTech announced that the U.S. Food and Drug Administration, or FDA, expanded our emergency use authorization for our COVID vaccine to include individuals aged 12 to 15. It's important to note that the Pfizer vaccine is the first COVID-19 vaccine that's been authorized in the United States for use in this group. And as our CEO, Albert Bourla, has noted, the expansion of this emergency use authorization represents such a significant step in helping the United States broaden its vaccination program and help protect adolescents before the start of the next school year. So we are so happy about this latest news.
Right. And I know that communities also around the country are also moving forward and including this group in the vaccination. We've seen it even here in California. Sally, last question, and this one's also from the audience. How was technology used to assist with increasing the diversity of some COVID-19 vaccine trials? And how can they be trusted, especially in healthcare and with regards to the pandemic?
Yeah, so I alluded to this briefly at the start of the pandemic. Data Robot was really focusing to build the most accurate AI-driven models out there to help predict the spread of COVID-19, and we did that. We're really, really, really proud of that work. But part of the platform that we're building on those forecasting models was trying to understand where cases were emerging and to identify hotspots before they started. And so once we did that, we were able to help the vaccine trial enrollment in order to speed up the vaccine trial enrollment and then basically get the vaccine authorized in record time. So then the question becomes trust, right? So how do we actually trust these AI-driven models? How are we confident that we're giving unbiased and accurate information? And so from a Data Robot perspective, what we believe is being notoriously rigorous and transparent about the data that is going into our models, constantly ensuring that we're bringing in the most accurate data that is out there, checking it, also bringing in new variables over time. So for example, when we started our modeling forecasts variants, the virus variants weren't really an issue, but over time now variants are a huge thing, and so we've incorporated that into our modeling in order to ensure the accuracy of our predictive models. But we believe that this applies to all AI models. In order to trust AI, you really need to make sure that you are rigorous and careful and transparent, that your information is understandable and explainable to even a layperson who has never heard of AI before. And then because of that, if you actually follow those guidelines, you'll be able to reduce bias and increase trust, and people will be more welcome to bringing technology into the fold because they're able to explain how it can be impactful and understand how it can lead to positive outcomes as opposed to negative ones.
That is great to hear. I have so many more questions for you, but we're running out of time. We're very limited with time, so I want to make sure that you all get a chance to give us a final thought that you'd like to leave the audience with, and we'll start with Dr. Congressman.
Sure, thank you. It's really been a pleasure to be part of this program today. I am somebody who's a people person. I've committed my professional life to people with kidney diseases of all kind, and it's a privilege to work at a company that is focused on delivering life-saving care, be it through the population health management activities that we have in our dialysis clinics and in the critical care that we support in the hospitals. We are committed to doing whatever it takes, and in this pandemic and with respect to the vaccine availability for this vulnerable population of patients, that included going to the CDC, going repeatedly to the federal government, working with state governments, local communities, local organizers. We are delighted and privileged to be part of communities and very much respect the need to engage those communities, to listen and respond. And so thank you for having me today. I really appreciate it.
Thank you, Dr. Congressman. Thank you, Rob. Dr. Dara.
Thank you, Ms. Ramos. I too must say it's been a real pleasure to be here with everyone today. While I think we can all agree that the past year plus of this pandemic is something that none of us ever want to see again, as one of the very few silver linings, I hope that we can all begin to see this pandemic as an inflection point, a real opportunity for each of us to stop and do a full reset and begin taking steps to help us establish a new normal on how we engage with and demand more from our nation's healthcare system so that it will better meet our needs and the needs of our families and loved ones. So let me just close by saying this. Despite the innumerable atrocities we have had to witness over the past year or so, the pandemic, along with continued social injustice and unrest, it's provided us with a coveted opportunity to just look in the mirror and commit to demonstrating what is best about ourselves as leaders, irrespective of race, ethnicity, socioeconomic status, gender, education, or any other demographic or social construct. It's incumbent on each one of us to figure out how we can partner with each other and with the next generation to create a much more fair, just, and equitable world. And I remain optimistic that if we put forth our best efforts, if we just keep putting one foot in front of the other and do what we can to build the arc toward equity, I know that we can and we will come out of this pandemic stronger and more resilient than ever. So I just want to say thanks again for the opportunity to join you today.
Great. I hope for that too, Dr. Dara. Thank you so much. Ms. Embry, final thoughts?
Yeah, just to echo what the other panelists have said as well, diversity is really going to light the path forward. Equity is not optional, it is essential. And then to bring about that diversity, we're going to need to be thoughtful and collaborative. It's going to take partnerships with healthcare providers, drug developers, public health officials, but it's also going to be needing people on the ground, people in the community that can really drive change and bring about encouraging underserved or previously marginalized communities, bringing them into the fold, making sure that they understand or they're given the opportunity to have a seat at the table and a voice that needs to be heard. And part of my hope is that technology is there to help bring connection points between those individuals and the people who are bringing about these great innovative changes and fighting against the pandemic as well, like bridging that gap between our individual, local, state, and federal partners to really ensure that this never happens again and that we have a way forward that is both diverse and equitable.
Great. Absolutely. Thank you so much once again to our extraordinary panelists for this thoughtful discussion, Dr. Rob Cosman, Dr. Dara Richardson Herron, and Sally Embry for being with us today. We are now being joined by Dr. Marcela Nunes-Smith. She serves as Senior Advisor to the White House COVID-19 Task Response Team and Chair of the COVID-19 Health Equity Task Force. Dr. Nunes-Smith, it's so nice to see you, and thank you so much for your time. Welcome.
Thank you so much. It's great to see you too. It's great to be here.
You were recently appointed, actually, by President Biden to lead a new White House task force dedicated to health equity. Such an important topic. A lot of our. How did this come about for you, and what are the priorities that are most critical for you and for this administration in addressing how the cities prepare to reopen?
Mm-hmm. Yeah, and just, again, let me say thank you so much. It's great to be here and be part of the summit and to have this conversation. If ever there were a time where we are all, as a collective, very much attuned to the urgency of equity across our communities, it's now, and it's a privilege to be part of this work and this effort. So as you mentioned, President Biden, in his first full day in office, signed an executive order that brought into being a COVID-19 health equity task force. That task force is actually housed at HHS. It is a great honor for me to be serving as chair of that task force. And, just a word about it, it brings together both federal and non-federal members, everyone extremely committed to advancing on equity. What's the charge for the task force? It is thinking, as you said, about how we make sure there's equity in the response to COVID-19. And so that's thinking, I'm sure, top of mind for people, where are we in terms of things like vaccination, but also other resources, PPE, testing, therapies, but importantly, the recovery. What do we need to do moving forward so that we're better prepared, so that we are disrupting the pattern of predictability of who is always harmed first and greatest in times of national crisis and who's left out when resources are limited. So it's wonderful to be part of this group. This is really important work. The group is advisory in nature. We'll be delivering recommendations once this phase of work is wrapped. But there are public-facing meetings every month. I invite people to join us. Each month's meeting covers a different topic related to COVID-19. And our subcommittees present interim recommendations there. And sort of where did this come from? We're really grateful to the Vice President Harris, when she was still in the Senate, actually started a blueprint for this work when she first introduced legislation to create a racial ethnic disparities task force specific to COVID-19. And so, here we are. The task force is hard at work, already generating recommendations.
Incredible. And, you touch on a lot of subjects and a lot of topics that I think have been vital for a lot of communities that have been hard hit in the past years. In the past year, the U.S. public health system has been underfunded for decades, and our nation's ability to quickly respond to the COVID-19 pandemic was devastatingly hampered by the chronic lack of investment. How can the private and public sector work together to fund our healthcare infrastructure, and what areas are in dire need of investment right now?
Yeah, absolutely. I mean, these are one of the lessons that we absolutely have to take away from our experience here with the pandemic. We were ill prepared. And, you're hard pressed to find a public health department that was ready to take this on. And I have to say, this is a moment where we can be humble and learn from our global colleagues. I had an opportunity to talk to people around the world and understanding how in many, many countries and economies where there just aren't the resources for the type of intensive, advanced healthcare delivery that we are so accustomed to here in the US, there are deep investments in public health and public health infrastructure. One example being around community health workers. When we think back to something like contact tracing, which is vital, our public health toolkit, we're fortunate to have scientific discovery and vaccines now, but the bread and butter is really being able to identify cases quickly and then do the tracing necessary and support people to be able to quarantine or isolate. And that's just one area where so many of our peers in lower middle income countries have us beat, quite frankly. So there is this need, this recognition to build back better, to reinvest in a public health infrastructure. The president just announced through HHS, actually with many interagency partners, a $7 billion investment in the public health infrastructure moving forward. Importantly, with an emphasis on hiring people who are from the communities that they are going to serve. I think these are just lessons. We have an opportunity. We can leapfrog, right? We can really do this well now. And the private sector, such a key partner in this work. This is everybody's work to make sure that we are secured as a public health infrastructure moving forward. Even when we think about things right now in time of vaccine, the role of the private sector and employers in making sure their employees are able to connect with these public health interventions like vaccination.
Right. I think for us as broadcasters, as journalists here at Univision, and I know along many networks, we've seen it really as being a problem since the beginning, right? Communities of color being affected dramatically for so many reasons. With these new incentives, how will they address disparities in healthcare in communities of color, especially?
Yeah, so absolutely. From the federal administration, from the beginning, President Biden, Vice President Harris have stated the commitment to having equity at the center of the pandemic response and recovery. These are not talking points for the administration. These are value statements. These are calls to action. There is a whole of government approach that is being taken to be able to make sure that we not only recognize, name that the pandemic has been disparate in terms of impact. Let's be real. I mean, we often talk about statistics. What we're talking about is loss and grief and suffering that has been disproportionate across these communities. We don't spend enough time talking about the mental health, the behavioral health consequences that we'll see as well. The educational gap and loss that we are trying so quickly to get ahead of, as the president has committed to getting our kids back to learning in person, meeting those goals, and then meeting the goals, of course, for vaccination in terms of not 100 million shots, but 200 million shots. But the scientific discovery has to be for everyone. And so, here we are talking about things like incentives, and that's where the private sector can be so transformative in this moment, making sure that the structural barriers that many people in communities of color face in connecting with vaccination in particular, can be overcome. Here we are thinking about something like transportation. We see Uber and Lyft sort of offering, giving. I mean, these are gifts of the rides to get people connected with vaccination. Paid time off, so important. People are so worried about that, to get vaccinated, but also if there's any recovery needed from the anticipated side effects of vaccination. These are roles for employers to pay, in addition to some of the creative, innovative approaches that can be taken to help incentivize people to get vaccinated. But you're right, vaccination, this is now, but we have to have pathways to economic opportunity and educational parity moving forward if we're going to disrupt the disparity.
Right. And that's so important that you mentioned it. Actually, today, one of our top stories in the newscast was precisely that, there was a new study talking about the Latinx community with the vaccine. And for the most part, the reasons why they were not getting the vaccine is, one, because they couldn't get the time off from work. They were scared of asking for it. Immigration status and the cost of the vaccine. They thought that it was going to be expensive for them. So changing the narrative, community leaders trying to advocate for, also making sure that these communities are addressed with these questions and these concerns, because they are valid. Dr. Nunez, the federal government also has provided, like you mentioned, the COVID-19 vaccine free of charge to everyone to all people living in the United States, regardless of their immigration or health insurance status. However, as we look at the rise in variants, there is a real possibility that we will need annual vaccinations, like for example, the flu. How can we ensure any future COVID-19 treatments remain accessible to low-income and minority communities?
Absolutely. This is the heart of it, right? And I'm so glad you raised this. And I'm so glad you referenced that study from the Kaiser Family Foundation, which really, I think, brought to light what a lot of folks in this space know. We have to talk about these structural barriers. And it is important, as you highlighted, vaccines are free, that data are well protected. No one needs a government issued ID to get vaccinated. And that myth is still out there. And there is no crosswalk of any kind with any immigration data banks or services whatsoever. We're encouraging people to get vaccinated. But here we are in the moment, and how are we thinking about the long term? It is so critical. Why are we here in this space in the first place? Is because we have unequal access to high quality healthcare in this country. And this is a big push that people need to be connected with medical homes, be able to get primary care preventive services. We can all sort of articulate that having multiple chronic conditions, particularly ones that are not well controlled or well managed, put you at greater risk for severe COVID-19. But we don't go back. We stop at this narrative of social, sort of personal responsibility, and we don't talk about the fact that people do not have access to healthcare that they can afford that is of high quality. And so that is something that the administration is also very much committed to. We see the enrollment period was reopened again through the ACA. So this is an important time to make sure everyone in the country can get connected to primary care and high quality care, so that as we move forward, should we see the need for more regular vaccination against COVID-19, all the things you already mentioned, we know people should be doing on an annual and regular basis, that there won't be barriers in the way.
Right. And I, last but not least, I would love to ask you, what do you think? How do you feel about the new CDC guidelines on mask wearing, and how will this affect the demand of the vaccines, especially like we were talking about in communities of color?
Yes. So lots of news out of the CDC on this front. I mean, we certainly saw earlier and first the FDA, then the CDC and those independent advisory groups coming out with recommendations to vaccinate 12 to 15-year-olds with the Pfizer BioNTech vaccine through emergency use authorization. So that's really big news. That's 17 million new people eligible in the country for vaccination. Half of 12 to 15-year-olds in the country are people of color. So I think something maybe everybody doesn't realize. So CDC came out and said, for fully vaccinated people, that there is choice now. There's option to go without the mask in indoor settings as well as in outdoor settings. There are some exceptions there, I think, important to point out. Congregate settings being one. Still more guidance likely to come in things like school and travel and businesses. And obviously, local jurisdictions still need to be followed in terms of what those orders and regs are on the ground. But we know that we have so much more work to do for communities of color in particular on the vaccination front. And so as we march towards this goal of 70% of adults vaccinated by the 4th of July, as the president has called for, so important, we have to double, triple down on equity. In the past couple of weeks, we see that the proportion of vaccines going to people of color, has increased. 45% of those first doses going to people of color. But there's so much more work to do, and it begins with access. It begins with making sure vaccine, it's easy, it's convenient, and that it's trusted. And then making sure that people have the information they need to be able to make those decisions for themselves, also now for their children and their families. We only get to the other side of the pandemic if all of us get to the other side of the pandemic.
Absolutely. That's the message that we hope everyone takes from today's session. Dr. Nunez-Smith, it was great to chat with you, to have this short but very meaningful conversation. Thank you for your time, and it's always a pleasure speaking with you.
You too. Thank you.
And once again, thank you to Dr. Nunez-Smith. She's been such an advocate for our communities, and we were also very happy to have her with us today. To our panelists who joined us earlier, and to you for being a part of this conversation, we invite you to share also what you took from from this chat, what you took from this panel. And once again, we thank you for attending our session. We encourage you to attend our afternoon panels at 3:15. And don't forget our closing panel, Equitable Infrastructure for American Growth. That's at 4:45. Please keep tweeting about the summit and share your insights using the hashtag CHCI Summit. Have a great day.